name is Terry Johnson. I'm a physician from Southern Ohio. I'm the former coroner of Scioto County and now the state representative of the 89th District. I have jointly sponsored this particular piece of legislation you're going to be introduced to because as a lifelong citizen of Ohio, a family man who has a stake in the future of our state, and as a physician who has dedicated my life to the health and well-being of my patients, I am appalled by the toll that prescription drug abuse has taken on Southern Ohio. I have observed the terrible effects of prescription drug abuse increase steadily throughout my medical career. As a medical student, resident, family practice physician, and finally as a Scioto County coroner. As a family practice physician and coroner, I witnessed a 360% increase in fatal overdoses in Scioto County in the last 12 years, and since 2002, half or more of the autopsies that I ordered in my role as Scioto County coroner revealed deaths that were caused directly or indirectly by drugs. I found that overwhelmingly, these overdoses were due to prescription medications. My statistics, along with many others, have been used by our local and state health departments to highlight the true extent of this tragic epidemic. As a result, we have actually declared a public health emergency in Scioto County. A mix of prescription drugs caused the majority of these deaths. At the top of the list are painkillers like oxycodone, the generic name for which is OxyContin. It's the generic name of OxyContin. Many of the deceased were also taking benzodiazepines, a class of depressants that includes Xanax, Valium, and Clomid. Other medicines involved in the deaths were muscle relaxants, sleeping pills, and antidepressants. Another fatal combination that occurred frequently was mixing of alcohol with these medications. Although the highest death rates were among 35 to 54-year-old men, we have lost people of all ages and from all walks of life. In addition to the loss of life, the trade in diverted prescription drugs in Southern Ohio has created a shadow economy which boggles the mind. These drugs are sold in huge quantities to both casual users who want to get high and to addicts who need a constant, unending supply. Criminals are reaping obscene profits while good, law-abiding citizens are left to pay the bill. Furthermore, ask any police officer about all the crime we have in Southern Ohio, and they will confirm what you suspect. The overwhelming majority of crimes in my area are related to drugs. Simply put, local residents who have become addicted to their medications are stealing cash to buy more. There are thousands of people living among us who must feed their drug addiction, but can't afford to do so. So they start stealing. They steal from their families, friends, neighbors, and strangers. A massive redistribution of wealth is taking place from the pockets of good tax-paying citizens to the pockets of drug dealers. No one should suffer in pain needlessly, and legitimate sufferers must continue to receive needed medication. But the abuse has to stop. Too many moms and dads have lost their children to this problem in Southern Ohio. Unfortunately, it has yet to peak. We are on track to have just as many of our loved ones die again this year as we did last year. Yes, forces are mobilizing, and people are working together as never before, but right now, there are just as many moms and dads on the verge of losing their kids as there were last year. People need to be treated, recover, and turn their lives around. Criminals who are greedily gorging on the misery of others can be brought to justice and appropriately punished. It's time to set things right. Every life has value, and each person has worth. It doesn't matter how far a person has fallen. All are worthy of saving, even those bent on their own destruction. We must not willingly concede a single soul to the blackness of this evil. I'll be followed by Orman Hall, who's the director of ODAS.
I'm going to be brief. First of all, I really appreciate the courage of these two state representatives in terms of introducing this legislation. Just a couple of statistics that I think are worth mentioning. First of all, going back to Representative Johnson's district, last year in Scioto County, there were 9.8 million doses of prescription opiates dispensed in Scioto County. a population of roughly 78,000 people. That is approximately 123 pills for every single man, woman, and child that lives inside the county. Going back to my home county of Fairfield County, we've been tracking opiate addiction for several years also. We did a race under treatment study in our local jail, and what we found was that in 2003, we spent about $350,000 incarcerating opiate addicts. By 2008, we were spending $2.5 million incarcerating opiate addicts. More than 90% of those persons that were opiate addicted were repeat offenders. So we keep putting the same people in jail over and over again. This may be one of the biggest cost drivers in our state's budget. It is a serious problem. The human toll is incredible, and the cost to our state is vast. Now is the time to act. These two state reps are doing a great job in terms of introducing important legislation, and ODAS stands ready to do whatever we need to do to support them in their efforts. Thank you.
Good morning, I'm State Representative Dave Burke from the 83rd House District, and I am also a pharmacist. I can't tell you how excited I am to join together with my friend and colleague, Dr. Terry Johnson. This is probably one of the few times in Ohio history you'll see a pharmacist and a physician come together on a bill. And what an important issue we've chosen to tackle. I can't tell you again how excited I am about this piece of legislation. I've been a pharmacist for over 2 decades. I would probably guess I've filled somewhere in the area of 500,000 prescriptions. We've seen a recent epidemic come to our state, and I've even seen it at my pharmacy in Marysville, Ohio, where almost daily I receive phone calls or visits from people with prescriptions from Portsmouth or Souda County or other parts of southern Ohio who travel all the way to Marysville to get those prescriptions filled. To me, it's just absolutely amazing. The fact that 4 people a day are dying in this state for prescription drug overdose is equally as amazing. And be clear, this isn't from medical error or misdiagnosis. This is from intentional abuse of controlled substances in our state. I would like to capitalize on a few important parts of this bill, and there are 5 major components. The first deals with the automated review system known as ORS, that the State Board of Pharmacy pursues currently. We look to seek improvements, and I will get into that part of the bill as well. We limit prescribers' ability to personally furnish controlled substances. We maintain certain reforms in Medicaid that improve customer or consumer education and allow for better care coordination. We pursue the licensing and law enforcement improvements of pain management clinics. And we develop a statewide prescription drug take-back program. To get into the specifics on those components, we have several strong enforcement tools that we're also partnering with this bill, one of which is to establish a new terminal distribution license with a pain management classification. This also creates a new $150 license fee that will help offset some of the costs from the bill, meaning this bill will have no cost in the long run except for saving lives. We define a pain management clinic, which does not include hospitals, medical and dental schools, and hospice. Be clear, this is a unique classification that is new to the state of Ohio. We also establish a punishment of not more than $20,000 for physicians who fail to comply with this new licensure standard. We allow the State Board of Pharmacy to suspend terminal distribution license if there are clear and convincing evidence that a practice is causing harm or impending danger to others. We set up requirements for applicants of this terminal distribution license with the pain management clinic classification that they shall meet. We close business loopholes that allow operations without terminal distribution license. We restrict prescribers from personally furnishing controlled substances that exceed the necessary 24-hour period. To be clear, this is a personal furnishment. This isn't in a hospital or other kind of setting. This is a physician owns the medication, physician is giving the medication out of their office. This is one of the major issues that we see inside the county, where the pharmacy itself is completely bypassed and people line up outside of a physician's office simply to receive pills. We restrict, in any 30-day period, a prescriber's ability to furnish controlled substances exceeding 2,500 dosage units in a rolling 30-day period. This way, the 24-hour clause cannot be abused. We capitate it both by hour and by day supply over a month period. And it requires prescribers to to report their dispensing to ORS. We do a better coordination and education within the Medicaid program. We require Medicaid managed care to establish this program to be known as Coordinated Care Services Program, under which Medicaid recipients who are found to obtain drugs, perhaps not medically necessary, and are required to receive those drugs at this point going forward with the bill from a single provider, i.e. a single pharmacy, to be designated by the Medicaid recipient. We rein in and realign the pharmacy benefit under Medicaid. We allow for drug utilization management under this new alignment. And according to NAMI, we also, because of this benefit, protect mental illness medications from certain managed care techniques. Be clear, no other state in this country has this provision in code. This will be unique to Ohio as we move forward in treatment and protecting mental illness. We establish a statewide take-back program for prescription drugs that are no longer being used. This is something that Representative Dick Adams has worked on over the past year, and we intend to work closely with him as well as the Attorney General. As such, we empower the State Board of Pharmacy, ODATIS, and the Attorney General's Office to create a statewide drug take-back program with certain guidelines. In the ORS program, finally, we require the State Board of Pharmacy to recommend improvements to us within a 6-month period, and the cost of those improvements to the General Assembly within 6 months of the bill's passage. And we put forth guidelines for this study. Some of you may remember last year with Representative Bubp, I produced a piece of legislation that dealt particularly with the ORS program. And I think as we use pharmacists and physicians and give them the tools to properly manage and prevent prescriptions from being dispensed, we also prevent pills from ending up on our streets. We'd be happy at this point in time to welcome Representative Bubp to the microphone. Thank you.
Thank you, Dave. Good morning. Well, I apologize for being late. The radio said the roads were in fine shape, and I didn't find any of those roads on the way up here. At any rate, it's good to be here. This legislation has been worked on. Dave Burke has just really put the time into it, years, in fact. And I'm delighted to be here and be part of this. Of course, Dr. Terry Johnson, much more of an expert in this area than I am. Representative Dave Burke, a pharmacist. I'm just honored to be a part of this. Did anyone introduce you this morning, Betty?
No, I'm just a bystander right now.
We've got Betty Montgomery here, former Attorney General of Ohio, and congratulations. Mike DeWine, what a great choice to select you to be in part of his administration there. Welcome aboard. And I know that Mike is anxious to get this legislation and be able to start helping save lives in Ohio, as is Governor Kasich. We've met several times with Governor Kasich, and he's anxious for us to get this legislation to him that he can sign it. Now, you've heard the technical terms of it. Representative Burke just went through all that, the acronyms, ORS, and everything. But I will tell you the bottom line is saving lives and saving the state of Ohio money along those lines. Medicaid abuse is, it's hard to determine how much of the abuse there is in terms of spending money, state money, tax dollars, our money on prescription drugs that people are then taking out and selling them and using that as the foundation then to get the cash to go back and get more prescriptions from the pill mills and to buy more pills and to sell them, hooking people, becoming dependent upon these drugs, and then tragically 4 lives a day estimated in Ohio. Adams County has been severely affected by this, as has Scioto County. And that's why I'm delighted to be working with Terry Johnson on this issue that's facing so many folks down in the southern part of Ohio. And I know that the Attorney General, the Governor, this issue has gotten the attention of everyone. And so perhaps most importantly, when Representative Burke and I introduced this legislation last year, we had some folks from Scioto County come up here. They have formed a group called Solace. And I don't recall all of the letters, the acronym SOLACE, S-O-L-A-C-E. What was that, Terry?
It's surviving our loss and continuing it every day. And it's a support group of folks that have lost their children or loved ones to this problem.
And we had over a dozen individuals up here that participated in that, and I know they wanted to come today, but with the roads, they were not able to do that with this weather. But this legislation is for families like that. And we can talk about trying to save the state dollars and Medicaid abuse and so forth, but the bottom line, the reason why Representative Terry Johnson, Representative Dave Burke, and Danny Bubp are up here is the goal was to try and save lives in Ohio.